Welcome to the Art of Marketing Operations, a Taylor podcast. I'm Glenn Bottomley, and today my guest is Chris Dufresne, Vice President of Digital Experience and Marketing Operations at Allina Health, a not-for-profit healthcare system based in Minneapolis, Minnesota, with 12 hospitals and more than 90 clinics throughout Minnesota and Wisconsin. Thanks so much for joining us today, Chris.
Thanks for having me, Glenn. It's great to be here.
Well, to start right off, you're proud to say that you are a complete tech nerd, and that's me too. So can you put your finger on where this deep passion for technology began for you, and why are you so passionate about marketing and technology?
Yeah, well, I'm fortunate to have grown up with technology. My folks tell me that I was on computers starting at 2 years old when we had an old Macintosh, one of the earliest Macintoshes, and I learned how to crawl up this bar stool and reach around to the back and flip the switch on, and started using a computer at a young age. So I would say it started very early, but then professionally, it started, in my early days at a department store company that was in Minnesota called Dayton's and Marshall Fields, which of course turned into Target Corporation. And Marshall Fields turned into Macy's. And I was working on a lot of projects there as we went through many transitions that many of us recall from the department store world. Continues to evolve, but especially in the early 2000s, lots of change going on. And that's where I really understood I love technology. I like helping teams through change. And I've continued to grow in my understanding of the consumer and how we can use technology to improve the consumer experience.
I love that. I was very similar to you. I remember my very first computer was called the Timex Sinclair 1000. And there was no monitor. You actually had to hook it up to your television, and you loaded software into the machine from a tape recorder, an audio cassette recorder. So I'm like you. I started at a young age, and it was like, wow, I was amazed with technology. So that's great. Well, and you talk a bit about consumer. So let's actually shift into a little of the healthcare space here. So how do you feel that marketing technologies need to coexist with things like, HIPAA or PHI or, protected health information, et cetera, while obviously still communicating with customers, with users, people, patients who are going to be in market for, specific medical services?
Yeah, security and privacy is very important. We all know that it's especially important in the credit card and the financial space. I would argue it's actually even more important in the health space because it is so personal to us as humans. And so we take it very seriously, like all health systems should, and hopefully all do. And making sure that you as the patient are in control of your data and information is really important, and that we are protecting it and being great stewards of that information. We want to make sure that the tech, of course, itself is secure. Data is being handled and encrypted appropriately. And we really want to make sure that we're managing opt-in consent, because we know that whenever you're transmitting information, no matter how secure you try to make it, how much you encrypt it, there's risk. Mm-hmm. And so we always want to make sure that our patients understand that risk. And we also, for example, try to limit the types of information in the email. I know as a consumer that can be annoying on the surface, where it's like, why is this email from my health system a little cryptic? Well, it's because there's a number of people who still share emails, and email isn't as personal as some of us might think of it. And we want to be careful that we're not sharing sensitive information within an email, and that there's at least some form of authentication or verification, if you will, of your identity before any detailed information is provided. So that security is really key, and we work hard as a healthcare organization. Our privacy, compliance, legal teams, and of course, my group and the digital team, making sure that we're all working together to protect the data.
Mm-hmm. And would you feel that is the same? So the information sharing, what the patient shares, the user, et cetera. Do you feel that that's the same even on patient education as well, like the incorporation of education into your marketing operations and digital experience functions as well?
I think it is. It, of course, depends on the specificity of the education, right? If it's how to care for yourself during pregnancy. That's pretty specific, right? But if
Mhm.
it's how to live a healthy lifestyle, that's, less specific and doesn't really call anything out about you or your specific health situation. So anything that's specific definitely falls in that arena of being really careful. And if a patient has consented and said, yeah, you can email me this type of information, then that's great. We put it in the hands of the patient to decide.
Hmm. And as you mentioned, health is such a personal thing. It connects us, with one another, but at the same time, it defines who we are individually. And so, one thing that I think is interesting to just kind of ponder from a marketing operations perspective is how does a large healthcare system sort of maintain the personal touch that you want to convey, reinforcing your brand, a sense that the healthcare system is respecting me, understanding me, while at the same time maximizing sort of the efficiency of your marketing operations, the ROI of your MarTech platforms, et cetera. So how have you found that it's the best way to strike that important balance?
Yeah, I think, it's hard because everybody has different expectations and comfort levels with the types of targeted marketing that happen. And we kind of become desensitized to some of it over time, but we haven't, in my opinion, in the healthcare space yet, which is good. And as consumers, we'll continue to evolve. So, an example, when Amazon came out and first started recommending products, there was a freak out, right? Of like, well, how do they know that I would like this? And then people come to realize, well, it's my previous browsing history, and they're using information to target me with specific products that may resonate. And Amazon has continued to tweak that over time and make it ever more intelligent, as have other e-com retailers. So that has kind of helped the consumer grow into this understanding and, in many cases, acceptance and understanding of how it is intended to help us, right? Related items, it's intended to help us find what we're looking for quicker, maybe find gift ideas for people. We also know as marketers, it's to drive business, right? And to drive growth and loyalty. From a healthcare perspective, we need to be careful because my hypothesis is a lot of people aren't ready for deep personalization in healthcare digitally. For example, if I go to a healthcare website and I start searching for information on knee replacements, I would be creeped out if on my Facebook feed, Insta feed, etc., all of a sudden I'm starting to see knee replacement information, especially sponsored content. I'd be like, whoa, wait a minute. This health system just gave my data to Facebook? Now, as marketers, we get it. We know a lot of that data is already being tracked wherever we go on the internet, not because of necessarily the company, the health system, et cetera, but data, you leave a crumb trail when you're using digital technologies. And so we want to be really respectful of that crumb trail. We're very careful with where we have that information and that it stays within the walls of Allina and is used really to help curate your experience, right? We're not sending it to third parties, and we never are selling the data that our users generate. And so it's important that we leverage that information without, and I use this term internally intentionally, without being creepy. Because healthcare data used in the wrong way can definitely be creepy, even
Yeah.
though many of us as marketers know a lot of the data is on there. A lot of the data for us is out there,
Yeah.
right? Not health data necessarily, but other consumer data, credit data, et cetera. There's a plethora of data. We need to be good stewards of how we use that data and how we help the consumer understand the benefit to them of us using that data to help improve their experience. And
I
then again, similar. Oh, go ahead, Glenn.
Well,
Sorry.
no, I was just going to say I was going to build on that because one of the in a recent book that I read, The Art of Surveillance Capitalism, Dr. Shoshana Zuboff from Harvard, one of the stories that she shares was that there was a story about a young woman who became pregnant, and then but what something had changed in her shopping behavior, and she had moved from like one of the major changes was she had moved from scented products to unscented products. And so that's one of that according to Facebook's engine, that was one of the, along with many other things, indicated that she would be likely pregnant. And then her father ended up getting, learning all about this information, sending, information to her. She hadn't even revealed this information to her family yet. And she was like, how, like to your point about how creepy is that? And so a really interesting example. So to your point, it's like, being good stewards of that information, protecting that information, super important because, it's really private information.
Hmm.
Yeah.
Couldn't agree more. Again, we know how it works. Many of those listening here, and even when we know how it works, it can still come across as creepy.
Yeah, yeah, exactly. Well, describe for us a little bit like how have you worked on websites and mobile apps in the past to maintain that nice strong personal touch with patients and still kind of maintaining this sort of firewall and making sure not sharing too much information. How have you sort of done that in the past?
Yeah, well, in the past, have used a lot of consumer data, and still today, of course, using Google Analytics data, for example, qualitative, quantitative research in collaboration with our consumer insights group. That data is very, very important. And then as we're designing and doing wireframes, clickable wireframes, et cetera, doing user experience research, using the many engines that are out there to do that. Of course, A/B testing too. And I'll be upfront, we're not the greatest at A/B testing yet. We need to continue to build out that capability. As many of us know, healthcare's a bit behind other industries when it comes to this type of technology. And we're trying to catch up. So lots of research, lots of data, and really trying to be more agile. And I know that's a buzzword these days and has been for many years. But being agile where we can release something to production, see how the user interacts with it, and then make changes and evolve it based on what we find from the users.
Mm-hmm.
And that's different in healthcare because a lot of times when we're getting actual care, you don't like guess and check, right? You want your provider to know this is what's going on with you, right? And we know science is all about guess and check. So trying to relate how we do this research and how we do digital and share that the similarities to regular scientific methods internally can be helpful. It's also interesting, and this isn't unique to healthcare, because I saw this in my time at retailers too. There's always a certain group within an organization that will say that the consumer needs to be at the center, but the reality sometimes is they're at the center. And in healthcare, that can sometimes be the physicians, right? And it's all well intended, and that's how healthcare has been for many years, but the power that the consumer has grown and continues to grow. The amount of information at our fingertips, as dangerous as Dr. Google can be, because it seems no matter what symptoms you have, it could always be something catastrophic, right? But really moving internally in our organization away from more of a physician-centric focus when it comes to the user experience design, and really shifting that to putting the consumer at the center.
Yeah.
Now, of course, that doesn't mean, just like others, you don't ignore your internal feedback, because what you do in the consumer space directly affects your employee space too. And so having a strong employee digital experience is foundational for a strong consumer experience, and both play hand in hand. So
Mm-hmm.
we really are serving multiple key users, but we need to be really clear which user are we really targeting. And a lot of times in our public facing websites, patient portal, et cetera, that is the consumer. Taking into account the employee or the provider perspective too.
Mm-hmm. Well, and to your point about the consumer's digital experience, one of the primary interfaces to the consumer, to the patient, is email. And but I also know that you actually have a very specific view about email. Can I be so bold in saying that you hate email? And that I know that you've shared with me in the past that one of the things that's important to you is making sure that the patient, the consumer, has the power to choose. They can participate in that. So can you expand on that a little bit? And how do you sort of solve for that?
Yeah, communication preferences, I think, is a challenge across industries. I mean, we see it, in retail, healthcare, hospitality, travel, et cetera. And managing that can be cumbersome because we know as marketers, there's a whole plethora of systems that are in use to create the experiences that we have every day. And so enabling the consumer to opt in, first of all, and opt out of the channels or the types of messages that they want. The safest way is to, for any organization, is to global opt out if somebody says stop. Well, in healthcare, that's pretty tough, like other industries too, I'm sure, because if I'm opting out of, say, a appointment reminder message, it doesn't mean I want to opt out of all of my, test result messages. Or if my doctor sends me a message directly, I want to get those, right? And so we got to make sure that we're providing a means for the consumer to really own how they want to receive information, whether that be email, SMS, snail mail, telephone, etc., and honor those preferences wherever we can. And so with texting, that's been a big one, right? A lot of people are like, well, why don't I get more text from my healthcare system? I get text from my hair salon and all these places. Well, we need to make sure that we're communicating with you in a secure manner, like we talked about earlier in the show. But we also need to make sure that we're honoring your preferences and that we don't just start bombarding you with text messages, because there's a lot of communication in healthcare, especially if you have chronic conditions and you're coming in for visits multiple times, you have multiple prescriptions, etc. There's a whole lot of communication, and we need to continue to find ways to throttle that communication so that we can prioritize the most important messages and maybe deprioritize and delay some of the less important ones. For example, a less important message might be information about knee replacements in the long run, right? Going back to my example earlier, we wouldn't want to start sending knee replacement information if you're awaiting a cancer diagnosis, right? Now, we don't have great ways of doing that today, but with tools like CRM, we know the functionality exists. It's how do we get the right data and the right build-in to create that experience while being really careful that we're not preventing messages from getting to patients. We want to make sure that they are getting the right information at the right time and that they really own how they're receiving it.
Well, and if you think about the technology sitting behind everything you just described, sort of the communication preferences and the unique timing of messages that go to the patient, and to your point, maintaining a sense of humanity around, gosh, I just got a cancer diagnosis. I don't want to receive a upbeat message about, hey, let's go through a knee replacement. It's a really, really strong example. But that technology and the infrastructure and the MarTech stack that you need to build that out and fulfill that digital experience for the user, I think it's got to probably be difficult to navigate, particularly in times like the recent global pandemic and COVID. So how have you sort of either tried to address those types of dramatic changes or need changes with things like, a global pandemic? How do you sort of tackle MarTech stack or look at that?
Yeah, like every organization, it's been a challenge, right? And will continue to be a challenge. In healthcare, the consumer has become more okay with digital because, frankly, as consumers, we were kind of forced into it, right? And just like in restaurants, people were forced into more order online and do carry out, right? And restaurants were forced into new behaviors and travel. It could go on and on. And so in healthcare, the consumer became more okay with digital. And some health systems and some folks within health systems really thought that digital was going to become the vast majority and stay the vast majority of the interactions. I don't quite buy into that because health is so personal. I'm not saying that we shouldn't offer virtual appointments because they are very convenient for certain types of visits. Like if I have a med check or a chronic condition and I've been taking my glucose readings every day and want to have a conversation with my provider, great. Virtual is a great way to do that. But there's some things that just don't make sense as a consumer even for me to want to do virtually. And so from a MarTech stack perspective, we had to scale quickly, especially the virtual visit capabilities and the ability to communicate with our patients using digital means. And we know that will continue. It has continued. We're happy to see that because we want to offer the convenience that the consumer desires. And virtual care enables that. And so we're looking forward to continuing to build out our tech stack and be able to personalize the healthcare experience more, balancing that with, as we talked about before, not being creepy.
Yeah, I very much agree with that. And when you think about sort of the best practices around that. How do you feel that marketing operations teams in the healthcare industry, what do you feel that you could learn from marketing operation teams in other industries, non-medical, non-healthcare, and vice versa?
Yeah, I think healthcare can learn a lot from other industries. That is for sure. Having come from the retail sector before, it's been a lot of fun helping people understand what some of the possibilities are using modern technology and modern marketing technology. So I think there is a lot we can learn about how to do email marketing, how to use SMS, how to curate and personalize experiences. Those are all things that we continue to learn from other industries, whether that be e-commerce. Hospitality is a big one to benchmark healthcare against because we really are in the service industry, right? There's some in healthcare like, well, I wouldn't define, as a product or service because it feels like it kind of belittles what healthcare really is. But when it comes down to it, it is a service, it is a product.
Mm-hmm.
And how do we leverage those other skills from other industries and organizations to kind of leapfrog from where we've been to where we need to be as healthcare? For example, I have a lot of control over the types of messages that I receive from retailers and hospitality. How do we make sure that our patients have as much control in healthcare? Now, there's been a number of government regulations that have gone into place that have required us to provide information to you in near real time. And I like that, don't get me wrong. I think it is great because as a consumer, as a patient, I want my data right away. Now, some patients would prefer their provider reviews it first and then communicates with them. The government has said, no, we're communicating it immediately. Now, there's certain things that we can provide the consumer to manage or throttle the communications. We have an option. So if you have 3 lab tests done, right? 1 blood draw, but 3 different tests. Right now, you're going to get 3 messages when those test results come back in, and another 3 when the provider has gone in and reviewed those results and added comments. That's 6. And that could be within 1 day, depending on the pacing of your provider and adding the comments. So we enabled an option with our technology stack that allows you to get a daily digest, right? That wasn't as relevant back in the day because you would have gotten 1 message from your provider summarizing all of the tests. But the government regulations, and again, consumer preference in many cases is we want to get the data to you right away. You don't have to wait for your provider to review it. So throttling communications and really putting the power in the hands of the consumer. And then as part of that, we need to educate the consumer on that capability because as consumers, we're not used to that from healthcare.
Mm-hmm.
And so how do we leverage the experiences we have with other industries and kind of correlate that to healthcare so that people have a framework to put it in?
Well, in the example that you just gave is a really powerful example about the vast amount of data that is available today. Just in your example of a blood draw, and then there's 3 various tests, and then you've got to get that data, and then now add to that all the other medical information, the timing information that you mentioned before. Who knows what other data points that are there. So, what sort of opportunities do you see for marketing operations, particularly obviously in the healthcare space, to take advantage or tailor products or to tailor services using this massive amount of data? You gave just one example right there, which is the Daily Digest. But if you fast forward, a year, 2 years from now, what other types of, thoughts or views could marketing operations be thinking of, or what lens should you be looking at of how to leverage that kind of massive amount of data for service?
Yeah, healthcare systems in general have a huge amount of data, as you mentioned, that can be used to curate the experience, personalize it, and offer recommendations. As we talked about earlier, we got to be careful to make sure that we're keeping pace with the consumer, not getting too far ahead of the consumer. I think there are plenty of ways to leverage additional data beyond health data and marry that up in order to curate that experience more. So, for example, when we go and buy life insurance, and I'm not an actuary, so I may speak incorrectly on some of this, but those companies know a lot about us. There's health screenings that are done, of course, but there's also a lot that can be said from your geographic location, right? And so there's a lot of data. And now with genetics, right, and the ability to understand more about genealogy, there's a lot that could be predicted. Now, some consumers would want to know that. I might want to know that I have a propensity for heart disease. Some consumers don't, right? That's scary. I'm going to just worry about it and fixate on it. So I would rather live in ignorance of that knowledge of information because there's a chance, but it's not a guarantee, right? And so there's a lot of opportunity to bring data together within healthcare, just pacing ourselves with the consumer and letting the consumer decide what types of information they need. And then the provider relationship is still really important. It may not be as important when you're 18, 20, 25, and you don't have a chronic condition, you're not looking to start a family. You can go to, the retail service clinics without much worry, right? But as you age, you need more healthcare. And you get more complex. And having somebody who knows you and knows your history is important. And if we can use that data to serve up information to the provider to use when they're having a conversation with you, that could be really helpful. Because my guess is people respond a lot better when a provider recommends they do something rather than getting an email, a brochure, a text message, whether that be from their health system or especially from their health insurance company. Because you trust your doctor that they have your best interests at hand. And if they tell you something, you're going to take that a lot more seriously and enact, behaviors than you might with just an email or a text.
Yeah. Well, in some of what you just described too, it goes to exactly your role of digital experience and how are you crafting that experience for the patient. But it kind of brings to my mind another sort of question, which is, so when you're thinking of that experience, you mentioned the physical experience, a patient going into one of the clinics. There is probably lots of physical marketing impressions that patient is exposed to. Wayfinding signage in the clinic or in the medical facility. Permanent signage. Maybe there's a trade show booth or something where the brand is out at the trade show. Promotional signage. Kits. Graphics, those types of things, even direct mail potentially. So when you think about the experience, particularly the digital experience, how do you sort of look at that incorporation of physical marketing impressions with the digital marketing expressions to create sort of that integrated marketing experience with the brand?
Mm-hmm. Yeah, it's important to do that because the consumer expects it, right? If a company's website looks entirely different than their in-store experience, you may not notice it. Us as marketers, we probably do, but there's just kind of a dissonance that can create. So you want to make sure that there's that consistency to show we are working as one organization to serve your needs. It shouldn't be drastically different from a primary care clinic to a hospital, right? Or to a specialty clinic. Now, the reality is in healthcare, it is pretty different. We need to continue to improve that. And I believe at Allina Health, we're really making great progress doing that, as are many health systems. An example I could bring up from the time of COVID was, if you recall back, airlines were the quickest in the hospitality industry to really highlight cleanliness and what they were doing to keep you safe when you entered their facilities. In healthcare, we took that tune and used that to be able to highlight for consumers what we're doing to protect them and keep them safe. At Allina, we use that opportunity to also roll out what I would say is probably one of our first real integrated campaigns where the web messaging, the telephone messaging, so patient instructions when coming in, et cetera, and the in-person experience were really aligned with our Safe Care Commitment campaign. We really wanted to make sure that the iconography was consistent, that the messaging was consistent, and that we prepared our patients for what they could expect when they came in back in for physical care. And so that worked really well. I mean, we took a coin from retail and created signage packages that we provided to each of our clinics with clear instructions of where to put the materials, where to put the sticky dots, right? All those things that I think in a couple of years we're going to look back at, maybe even now, and say, wow, we really didn't know a whole lot about this. And that was the case. So how do we use those experiences and those campaigns going forward? And that's what we're really looking at. Again, this is where the beauty of healthcare is we can leverage other industries to learn from them and apply it. So kudos to our creative teams, our operational teams, all the teams who had to come together to make sure that that experience was consistent, whether you were interacting with us digitally, by phone, or in person.
Such wonderful examples there. Thank you. So, Chris, before we wrap up today's episode, what is the main takeaway that you want to share to understand the challenges that are facing marketing operations executives today?
Yeah, I think it's really balancing personalization with creepiness, right? And how do we use the data to do good for people and make their lives easier and help them be healthier? So much of healthcare is about changing human behavior. And changing human behavior is more than an email. It's more than text. It's all of those things coming together with relationships to drive the right behavioral change that's needed. So what I would say is that a big takeaway is let's leverage the tools, the technology, the data that we have to continue to go down a path of personalizing and improving the healthcare experience to ultimately help people stay healthier, to enjoy life more, and decrease the cost of care, right? We know healthcare is expensive. It's a huge part of our GDP. A lot of our taxpayer dollars go to healthcare. A lot of our own dollars, our own, if you're an employer, so much money goes into healthcare because it's extremely important. So if there were ways that we can help people save money by taking care of themselves better, we really need to do that. And there's a lot more models that are happening within the healthcare industry that are incentivizing healthcare systems, payers, et cetera, to do just that. Because we've always wanted to do that, and we have always done it. Just haven't always been rewarded for it financially. And now there's more models in value-based care and population health that are enabling that. I think that's going to really help change how healthcare interacts with us and the total cost of care as we look at the lifetime cost for my care, for example, or yours.
Yep. Well, what a great summary, Chris. Thank you so much. Well, this wraps up this episode of The Art of Marketing Operations. Thank you so much for joining us today, Chris.
Thanks, Glenn. It was a lot of fun. Appreciate it.
Absolutely. Well, until next time, stay safe and take care. Bye now.
Thank you for listening to The Art of Marketing Operations, brought to you by Taylor. Don't forget to hit subscribe in your favorite podcast player. If you enjoyed this episode, please rate, review, and share. Until next time.